Good afternoon. My name is Dr. Michael Caldwell. I'm the Director of Public Health for Nashville-Davidson County, and I'm pleased to welcome you here to another one of our series of webinars to begin a conversation about COVID-19 and as we move from our current state slowly to the first phase of reopening. I'd like to thank Mayor Cooper as well as Mary Falls in the Mayor's office for helping to put this webinar together. And I'd like to thank all of you who are joining us today, especially those of us who have joined to participate with presenting information to you. After I provide you some introductory remarks, we're going to hear from Dr. Alex Jahangir, who is the chair of the Board of Health, as well as the chair of the Mayor's Coronavirus Task Force. We are also pleased to be joined by Grace Smith, the Executive Director on the Council on Aging of Middle Tennessee, who will talk to us about what do the next steps look like for those who are 65 years of age and older. We then will have a peer-to-peer segment with Dr. James Powers from the Division of Geriatric Medicine at Vanderbilt University Medical Center. He'll talk about some of the health implications for our older population. Then we'll be joined by Dr. Ari Nettles, Associate Professor of Clinical Pediatrics and Director of the Office of Inclusion and Health Equity at Vanderbilt University Medical Center. He's the chair of the statewide Planning and Policy Council for the Tennessee Department of Intellectual and Developmental Disabilities. He'll be Dr. Nettles will be providing information regarding the psychosocial implications for those over 65. And then finally, we'll be reviewing again with Grace Smith, the Executive Director on the Council on Aging in Middle Tennessee, some of the great resources that are out there and available for you that give us a great head start. So right now, we would like you, if possible, to use the question and answer feature on the chat box. We think there's a technical problem with that, but if you're unable to start asking your questions through that chat box, Mary Falls has offered her email as a backup, so please take this down. It's mary.falls, F-A-L-L-S, at nashville.gov to ask for your questions so we could start looking at those and answering them during the question and answer period. So this is a time when we are recognizing that COVID-19 is a virus that we have to live with. I have issued a Health Directive Order Number 4, which requires signs to be placed at all places of business saying, please join us in following CDC guidelines and wear a mask to protect our employees and to protect each other. You should be seeing these signs up at all locations where you shop, and we're also going to be requiring that employees of any place that you go into have to wear masks, and we would very much like businesses to require that people coming into their businesses wear masks as well. I went to a local coffee shop recently, and there was somebody outside standing, an employee with a mask, greeting people, asking people, please do not come in unless you have a mask. So first thing is make sure you do have a mask because you may not be able to go out. Oh, of course, the safer at home order, even with phase 1, we want people to still stay at home if you're over age 65. And you may feel, well, this opening phase 1 is for everybody but people over 65. And in some ways that's true. But we're trying our best to find ways that we can live with this to protect our elderly community. One of the things we've learned is that there are certain businesses that are providing certain hours for where there will be less people in the business, so you could plan out your activities and shopping if you are over 65 or in the chronic disease category, so that you will have more space to be able to provide for that social distances. So we are have this as a continued conversation. This is just the beginning, and we want to learn from what you're doing, learn best practices, and most importantly, keep everyone safe. Dr. Alex Jahangir now is going to join us to talk some about the nuts and bolts of operating now with COVID-19. Dr. Jahangir?
Thank you, Dr. Caldwell, and good afternoon. I would like to personally thank all of you for taking the time to be part of this important webinar. I think one thing that we've learned already about COVID-19 is that it is a virus that disproportionately impacts our older population as well as those more medically fragile. While the majority of patients who actually are infected with this in Nashville are between the age of 20 and 40, all of the deaths, and we've been, if you want to call it fortunate that we've only had 35 deaths, but we have had 35 deaths. All of those have been in people who are older, and all of those people had medical comorbidities. So I tell you that to say this is unfortunately a virus that disproportionately impacts the people we're speaking to right now. And I think because of that, we just have to be vigilant, where it's very easy to hear about cities opening up, and I'll get into that in just a minute, or the states opening up. Please understand that if you get the virus and you fit that high-risk category, you have a much higher likelihood of having a much more challenging course, resulting in even possibly death. I had a friend of mine who recently had the virus, passed it on to his father, who's in his 80s, and his father just passed away a few days ago. So it hits home, and so that's why this, to me, is such an important conference to be a part of. With that said, let me talk about kind of the roadmap. As you may have heard this morning, Mayor Cooper announced that we as a city are expanding into phase 1 of our reopening. And what that means, the difference between where we were today and where we are on Monday is this. We still will ask you to stay at home if and when possible. Socially distance, wear a mask, wash your hands. Take out delivery if you can. But now, if dine-in restaurants are allowed for up to 50% of occupancy, fire marshal occupancy, with tables spread 6 feet apart. And also, there's no more than 6 people per table, per party. So if you go in with more than 6 people, expect to be seated apart. Retail stores, similar things, separated by distance, 50% occupancy. We're asking businesses to try to mark where distance are as you're waiting to pay. Possibly a place to put up plexiglass. But all of that being said, we are going to continue monitoring those metrics, the metrics of trend of how the cases are growing, doubling time, how quickly is this virus replicating in our community, the time of if when we test everyone, are we staying around the same level of positive? Since April, we have been 10% positive in our city. The World Health Organization shows that if you're around 10% positive, give or take a point or so, you've got a pretty reasonable active testing system. Our testing system is one that I'm really proud of. 5 days a week now at 3 locations, Nissan Stadium, Kmart Antioch, as well as Meharry Medical College. You can go up, drive up, and get a free test. The results, it's minimal waiting time. Results are back pretty quickly. The challenge, though, is if you have a positive test, what do you do? And big thing is going to be to check oxygenation and so forth. Now, assuming that over the next 14 days, those metrics I just mentioned are stable, and a strong public health infrastructure, which we have, which allows us to quickly kind of wall off these brush fires of cases and prevent them from community spread. Assuming all that is still stable, 14 days from now, we'll expand to phase 2, which will open up more businesses and capacity. All that to say is the city's opening, more traffic will happen out there, more people will be going around and being vectors. So it is critical, if you can avoid that, please avoid it. I know it's hard. The new normal won't happen. The new normal will happen now, but back to what we knew won't happen until there's a vaccine. And herd immunity, while some people talk about it, people in this age range and this medical comorbidity are not the group that needs to be talking about herd immunity. I think that is really ill-advised. So with that said, I want to pass it on to our next speaker, and I look forward to the questions. And our next speaker is Grace Smith, Executive Director. So thank you.
Thank you very much. And to start off by expressing appreciation to Mayor Cooper and our public health officials for so closely monitoring the COVID-19 situation and creating a careful and targeted reopening plan for us. As one writer said recently, we are not all in the same boat, but we're in the same storm. And I think that is a very accurate description of what we're facing today. As we've heard and as we all know, older adults have a much higher risk of serious illness and death from this virus. So it is vital that we do everything we can to prioritize the health and well-being of older family members, neighbors, church members, friends. And if you are an older adult, we ask you to continue to stay home as much as possible and use a mask and to continue to practice good hand hygiene. I want to tell you that we can get through this and we will get through this together. And I want you to know that there are a number of organizations, government, nonprofit, that are working on the behalf of older residents and are ready to assist you with needed services and support. I wanted to share, first of all, that as a nonprofit agency that identifies and addresses community needs, we recently surveyed government and nonprofit partners to ask them, what are the biggest challenges you're seeing with older adults and your clients facing this pandemic? And the top three challenges that were mentioned were, number one, social isolation. Number two, food and medication access and delivery. And number three, caregiver support and relief. And when we asked these same partners what needs are not being met adequately, the same three categories came up, and number one again was social isolation. So I bring that up to say, we know it is really hard to stay home. It's hard for everyone, but it's especially hard, I think, as an older adult, knowing the risk that this virus poses. But we want to say that we just need to be more intentional in finding ways to stay connected to people in the midst of having to maintain physical distancing. There are ways to do that through phone calls, through FaceTime or Zoom or other video conferencing, and many of you are probably using those things if you can. Certainly we can all pick up the phone and call a neighbor or a friend or a family member when we need to. I know a friend of mine has been having back porch visits with her mother, staying 6 feet apart, but it's a way to stay connected in the midst of what we're all going through. As I mentioned, we're really fortunate to live in Nashville and in a community that really cares. And there are a lot of wonderful volunteers out there who are helping to deliver groceries and medications. They're out for food boxes. Our nonprofit partners are busy with meal deliveries, food deliveries, providing telephone reassurance. There's support available to you, and in a little while, I'm going to share with you some of the resources that I hope will be helpful to you or perhaps to a friend. But right now, I'd like to introduce Dr. Jim Powers, a geriatrician from Vanderbilt. So he will provide us with more information about what the health implications are for this virus and how steps we can take to stay healthy. Dr. Powers?
Thank you, Grace, and hello to everybody listening and viewing us. I'm Dr. Jim Powers. I'm a geriatrician and a member of the Nashville Academy of Medicine. I care for many Nashville seniors. These are our mothers, our fathers, our grandparents, And I have lost patients because of the COVID-19 crisis. I've seen firsthand the difficulty families have, the anguish they have when they can't visit the hospital, can't visit the nursing home to visit their loved ones. And I'm also very conscious of the very real risks of our fellow clinicians who go out every day to help take care of folks and worry about bringing home a virus that may affect their families or affect their own health. The first responders are also in those same categories. It's a very, very real concern. This pandemic is a healthcare crisis, but it has enormous social, economic, and psychological consequences. The crisis also represents a defining or transformational time for all of us. This is generating fundamental changes in the way we think about our world, care delivery, the way we treat our fellow citizens. It is resetting cultural expectations and will probably shape our world for decades to come. It has also identified gaps in medical care and insecurities in food and supply resources, and also the digital divide. As Dr. Jandigar had alluded to, no one is immune from this disease. We have no immunity to this new virus. And Davidson County is a hot spot for the disease in Tennessee. 85% of the mortality in Tennessee is individuals aged 60 and above and those with chronic illnesses. African Americans have 3 times the chance of dying from this disease, and nursing home residents have 10 times the risk of dying from this disease if they contract it compared to the rest of the population. Truly, we are all in this together. Frequently, I get asked, what can I do? What can I do to help? We know a vaccine may be some time off, and we're going to be dealing with this for some indefinite future amount of time. It is not safe yet for senior citizens to be out and about. So we have to help them to adapt to the stay at home, the safer at home policy that still is very appropriate at this time for our senior citizens. Social isolation and loneliness are very common. How can we help counteract that? As Grace mentioned, call people up, call your relatives, call friends who are having difficulties. Maybe they're caregivers and they're having difficulty reaching out to their loved ones in a hospital or a nursing home. Help senior citizens, maybe your neighbors, deal with new technology so that they can actually spend some FaceTime, do some video chats, or even just use a cell phone that works well and that can connect with their relatives. Be aware that there are many services that have adapted now to our healthcare crisis. Home health agencies, counseling services are all doing things by telehealth now, and that's a good thing. Physicians' offices as well. You can ask for prescription refills, you can ask for video office visits, and these are very, very available in most practices in our city. Realize that prescriptions have a drive-through pickup capabilities at pharmacies, as is drive-through curbside grocery pickup. Help our seniors understand how to deal with these new ways of obtaining services, and I think that will go a long way to help families, caregivers, and our seniors as well. If you have the ability to contribute to supplies, know that the Metro Health Department and Emergency Services and the State Health Department are accepting donations of personal protective equipment. This is very important for our long-term care facilities who often do not get enough of these supplies and their staff go unprotected. This is also a good time to realize that we're all vulnerable. And having an advance directive, that is a living will or expressing your wish for future care, is so very important at this time. There are a number of resources to help you with that, and I think that you will find a list of them at the end of this program. But it's very important for you to be able to express your wishes, not only because we can honor your wishes, but also so that your family knows that they are doing things if they have to make decisions on your behalf when you're not able to do that. So it's a very appropriate time to consider having advance directives. Please help shape the future of what the world will be like, the new normal. And this may actually help us bring out the very best in our community and society. And I agree entirely with Grace. Nashville is a very generous community, and we have many resources. I'm so happy to be here helping others know how to share these resources with those in need at this time. So thank you. I'll turn the mic over to Ari Nettles now, who is a professor at Vanderbilt. Dr. Nettles.
Thank you very much, and thank you to everyone for allowing me to share in this conversation. All right. As Executive Director Smith and Dr. Powers have shared their thoughts and comments, I'd like to kind of provide a framework of how to think about the psychosocial impact of all of this with our individuals who are 65 plus. So when the invitation came to me, I started thinking, will reentry improve and enhance aging in Nashville post-pandemic, making it the healthiest and the most ideal place to live and to grow old? Or will the older adult remain the most vulnerable due to the impact of social determinants of health and aging in society as we know it now? So I'd like to kind of use this as a framework or giving a snapshot of how older adults see their world and the psychosocial impact, and also how best practices to help further us in our newness, so to speak. So when we think about individuals who are 65 and older, we're talking 6 decades or over 6 decades of experience. We've seen a lot, we've done a lot, we've given a lot, we've had conditions that shape us where we live and where we learn and work and play and build relationships, and just a wide array of factors that also have an impact on our health and our health risks and outcomes. There's safety issues that we know about. There are issues of respect, access. Executive Director Grace talked about isolation and access and support, as well as Dr. Powers. But one of the key things, too, that we have to remember in the age group, this age group, is that we're also thinking about our age, our personal beliefs, or how we see our aging and getting older. And there's the institutional belief about age. Sometimes the institutional beliefs about age are not as kind or as favorable, and at times may even prevent or hamper opportunities and a sense of enrichment and enhancement. Intentional attitudes about age, where there are those biases against those who are older and with complications or complex conditions, with disabilities, health, so forth, but taking advantage of the most vulnerable. And there's the unintentional approach to age, where we're really unaware that we are impacting or making, having relationships that are not as favorable for those who are old. We are social creatures. We're human beings. we thrive and we need social interaction. And when these social interactions are hampered in such ways where isolation, which separates us from others, particularly in situations where individuals live alone, which is not unusual to the older individual, or living in rural areas, or experiencing financial constraints, widowhood, being misunderstood, misrepresented, and sometimes poorly represented. And there are those who are more resilient than others in situations. This social isolation that can certainly have a significant impact to a point where it becomes somewhat overwhelming, or the loneliness can develop into other conditions of anxiety and depression. This is not unique to just older individuals. All of us in this pandemic situation are susceptible to these particular feelings. However, if you, as Dr. Powers has noted, that if these conditions are such as isolation and the other anxieties and depressions and such, can certainly contribute to worsening physical health as well as mental health, and even resulting in substance abuse or poor nutrition or sedentary habits or poor that are not doesn't encourage activity and poor sleep. The brain research says that the areas where we feel physical pain is that same area where we experience loneliness or isolation. And so this is very, very real. Our thoughts and our feelings, how we see things, how we understand things are very, very real. So we have to think about just these few highlights that I mentioned here. How will reentry take those into consideration? How can we improve those social determinants, where we're living, where we're getting help? We know that what we've learned from this pandemic, that there are marginalized groups. It has a significant impact on the lives of African Americans, people of color, and of course this disease knows this pandemic knows no age, but there are vulnerabilities. And vulnerabilities for the older adult and those with other compromising conditions and complex conditions can certainly not thrive as well. So what are some just real quick institutional approaches that we can think of? My suggestion is that we think about more professional support in social and emotional and mental wellness. If you notice, I use the term mental wellness rather than mental illness, but mental wellness. Institutional supports that will guarantee or physical safety as well as psychological safety. We have to have a sense of belonging, and for others to recognize how important a sense of belonging is with our relationships. We all enjoy being out and seeing others. We do have this new type of life that we have to get used to, but there are so many ways that we'll talk about and elaborate in a few minutes. But it's very important to realize that a sense of belonging is a sense of thriving and functioning. Being very genuine in relationships, with kind of interpersonal, the interactions with others. Establishing safe zones. Many of us have wonderful support systems with families and friends and so forth, but there are those who are not, that is not made available to them. And so to have a connection with someone or many persons or an organization, there are many ways to do that. Access is an institutional need. Access to healthcare, access to support, value that. We need to encourage patience, time for healing. We need to encourage and really promote respect. And this goes across the entire lifespan. But I think it is particularly significant for reentry of the older adult in Nashville. So again, my question is, will this be one that will make Nashville a prototype of one of the healthiest places to have a reentry process that really focuses on the enhancement and the enrichment of services and provisions and recognitions and acknowledgments of the older individual? Or will things somewhat remain as we knew them before? So those are the I close my comments at this point, and thank you very much for this time. And I believe it goes back to Grace.
Thank you, Dr. Nettles. I certainly hope that we come out of this a stronger community and stronger as individuals, and that we can hopefully see silver linings in the midst of what we're going through right now. I want to talk for just a minute about resources in the community. And I want to let you know that if you're an older adult listening in today, that we care about you, and as a nonprofit community, as government agencies, as health providers, you are not alone in facing this virus. And there are services available, including friendly phone conversations. If you would like someone to call you once a week to check in on you and just have another friendly voice to talk to, both the Tennessee Commission on Aging and Disability and AARP Tennessee have set up these telephone reassurance programs where you can get a phone call, and even if you're a caregiver of an older adult, you can request a phone call from a volunteer to check in once a week and see how you're doing, and then see if there's any support that you need. And I believe this information will be shared following the webinar. There are also a number of organizations who offer helplines. The Council on Aging, my organization, is certainly one of those, and if you need to call for any information, most people know us for the directory of services that we publish. You may have seen this book. If you don't have a copy, you can call us and request that we mail you a copy. It is full of helpful information and including listings of services throughout Middle Tennessee. You can reach us at 615-353-4235. Also, United Way has a 211 number. Very simple to remember. You just dial 211, and you can call them with any type of request that you need, whether it be food assistance or financial assistance or mental health support, and they will refer you to organizations in the community that can help you. So 211 is another great resource that we have. Also, the Area Agency on Aging and Disability provides a number of services, and their number is 615-743-3416. And lastly, I wanted to mention 50 Forward, one of our partner nonprofits. They have a resource line for Davidson and Williamson counties where you can call if you need food or meal support or any other type of service. 50 Forward's number is 615-743-3416. Again, please don't hesitate to reach out if you have any need that you would like assistance with, because there are many caring professionals that are willing to help connect you with whatever it is you're looking for. Even if it's explaining how online ordering and delivery works, we're happy to do that. I wanted to tell you about some of the other resource guides we offer at the Council on Aging. If you are a grandparent raising grandchildren or caring for grandchildren, we have a guidebook for you with a lot of helpful information. It's available on our website and also in print. Our website is coamidtn.org. We also have a book called Aging and Caring, Things Families and Caregivers Need to Know. That's a wonderful resource for anyone caring for an older adult. And we have an end-of-life planning guide with important things. For example, Dr. Powers mentioned advance directives and letting your medical wishes be known. But our end-of-life planning guide is another helpful resource for families. And one thing we haven't mentioned today, but we need to be mindful of, is there are unfortunately a lot of scams right now related to the economic impact payment, related to the coronavirus. And we are working with AARP and a number of other organizations, 50 Forward, to make sure that older adults stay informed about these scams so you can protect yourself from becoming a victim. We have a free email that goes out, our Scam of the Month email that you can sign up for on our website. Again, that's coamidtn.org. And you can sign up for our weekly newsletter as well. We continue to put helpful information and resources in our newsletter. So that's another way to stay informed. And we have added a COVID-19 resource page on our website. I mentioned United Way 211. They also have an excellent COVID-19 page on their website. So I encourage you to look at the resources available on United Way's website. There were two other resources I wanted to mention, and again, there are many more, but I'm just trying to hit some of the ones that we know may be top of mind right now. Again, Dr. Powers mentioned advance directives. You can look up an agency called Honoring Choices Tennessee. A wonderful statewide organization that provides helpful information on advance directives. And they even have a form that you can download and fill out and share with family members. So if you are thinking about wanting to get advance directives in place so that your wishes are known about your medical care and end-of-life care, we encourage you to reach out to Honoring Choices Tennessee. And lastly, there is a legal helpline that is available, the Tennessee Senior Law Alliance. And I will give you that number. It is a free legal helpline for any Tennessean who is 60 or older and facing any issues in terms of economic issues, homelessness, hunger, exploitation, having difficulty accessing health care and benefits. We encourage you to reach out to the Legal Senior Law Alliance helpline, and that number is 1-844-435-7486. Again, another wonderful resource that we have available here in Tennessee. So with that, I think at this point we are going to have questions and answers.
We are. Thank you all. First question for Dr. Caldwell, please. And I will say anecdotally that the questions are all awesome. So we will get to every one of the questions that's come in. Dr. Caldwell, some countries are using ubiquitous vending machines to distribute masks. How will Nashville operate and distribute masks in the most effective way going forward?
Well, there are many different types of masks, certainly in healthcare environments where they're taking care of people who are known to be sick. They should be wearing the N95 mask and other personal protective equipment. This mask here that I'm demonstrating is a surgical mask. There is a video to show how you can make your mask at home. We're asking everybody, if you cannot acquire a mask, to make one at home. A lot of people, a lot of community groups are making masks to give out. There are going to be more and more masks available. In addition to all of that, I'm pleased to say that through the state, we have given out 27,000 masks just yesterday. So I think it's a group effort. We all need to try to identify masks, find masks. We want employees of businesses to wear masks. We would like the employers to provide them those masks or make sure that the facial covering that they're wearing is clean and acceptable. So it's really a group effort. We're going to be augmenting that effort throughout the community. Thank you.
Another mask question, Dr. Caldwell. This gets at the inconsistent information that's been made public over the last several months regarding masks. Several months ago, health officials said that masks are not effective in dealing with COVID, and now we're told we have to wear them if we're over the age of 2. Can you explain what's changed?
Early on, there was a real concern about the supply of these masks, and we were very much concerned that the healthcare providers were not going to have enough of them. So I think the earlier concern voiced by the Surgeon General on this issue was directed to that specifically. As we've learned more about this virus over the last couple of months, we've learned that a lot of people are walking around asymptomatically. So me just breathing, even though I feel fine, I might have the COVID virus in me. So I can protect you by wearing the mask. So it's important, as we are asking employees of places, asking the rest of the community to please wear a mask when you're out. That is you showing respect to others. I am protecting you through my breath. So the more that you see someone with a mask, when I see someone with a mask, I feel safe. And if I have maybe forgotten my mask in the car, I will go back to try to get it because I want whoever I encounter to know that I respect them and I want them to feel safe around me.
Thank you. Next question's for Dr. Powers. My son and daughter-in-law are having a baby next month. I'm 68 years old. Please comment on whether or not I should go or not go given the COVID issue. Her doctor told her that it's up to the parents to decide. My son and daughter-in-law have not been as careful as I've been.
That's a very hard question that many families are grappling with. My recommendation is that it is safer to not go. I know it's a very emotional time. The support that you can provide indirectly may have to suffice. Realize that you are at the highest risk of contracting it, but so is a newborn baby. And unfortunately, this virus says that we can be asymptomatic for up to 6 days. So until we have adequate testing to know everybody's negative before they get together, I'm afraid that we have to come down on the side of safety. So being present at the delivery is not recommended. In fact, you may have a severe limitation of visitors when she comes into delivery to deliver as well. Many hospitals are very, very strict about visitors.
Thank you. Another one for you, Jim. I'm over 65 and have underlying medical conditions. I got COVID-19 and have recovered from it. Should I continue to go by the over 65 guidelines, or can I assume I have immunity and will not be reinfected?
We don't know that. We don't know the extent of the immunity. That is really a very new question for us. We are recommending that you don't want to catch it again, just like the flu. You don't want to get it again. But I am so happy that you did get over it. You are of blessed with a better immune system than many of your cohort. But whether a person can get reinfected, whether that one infection protects you, should you get infected again, is really an unknown. The best recommendation is to continue to consider yourself still vulnerable.
Thank you. Another one for you, Doctor. I'm 70 years old and I live with my 35-year-old daughter who returned to work this week. I have been staying home since February. Our concern is what to do about our living circumstances. She goes to work in the morning and I disinfect everything, and when she comes home, she puts her clothes in the washer, she puts on a robe, showers, returns the robe to the washer. We clean everything she brings home, her lunchbox, her keys, etc., and we stay 6 feet apart. How much social isolation should we maintain between each other while in our home? Do I need to stay in my room? Does she need to do the same? Does the virus hang in the air? Do you have any suggestions what we should be doing other than disinfecting and maintaining 6 feet of distance?
Well, I think that you have certainly done a wonderful job to protect both yourself and your daughter when she comes home from anything that may have been contaminated. As far as the time that you are together, maintaining 6 feet distance, I think, is impractical and unlikely. Most families cannot keep that up. Is it necessary? Probably not. In terms of when your daughter does go to work, she should, however, maintain 6 feet from other co-workers. That's very important. And to wash her hands frequently. If she can also obtain an alcohol-based solution, 60% or more alcohol does kill the virus, and frequent hand washing is very helpful in this in breaking the transmission. What we know of is that although family members can infect others, it's less likely than going into crowds where you don't know who has it. So family members are less likely to transmit it to others, at least in our environment, our society.
Thank you. Dr. Jahunger, churches want to open and they usually attract older populations. What suggestions do you have for churches? Personally, I think it's safer to worship from home.
Sure. So, I think at this time of where we are in our history or society, I mean, I recognize the significance of place to worship for spiritual support, for just camaraderie. I think worshiping from home, if possible, is ideal for most. It's definitely a safer option for especially individuals over 65 with medical comorbidities. The state of Tennessee has allowed churches to open at half capacity. Our recommendation is if that churches go to one person per every 200 square feet if you are going to put a limit on the size. But if you do choose to worship at a place, I think speak with your church leader or your rabbi, your imam, or whatever place you worship, and express to them your concerns. See what they're doing to try to protect you from getting sick. Typically, churches actually do have an older age crowd, and so it is a place that I worry about a lot about getting transmission. So. Be reverent from home, and then if you, like I said, want to go there, speak to the leaders of the place of worship to see what the best way to do it. So thank you.
Another one for you, please. So there were two or three questions on this topic. I'm going to choose this one. It says, this is an organization called Senior Ride Nashville, which probably everyone would want to know about. I work at a nonprofit that provides volunteer-driven transportation to seniors. It looks to me like people age 65 plus are expected to shelter in place through all 4 phases of the reopening plan, potentially until a vaccine is developed and available. Is that correct?
That's correct, and that's hard to say. And, everything is, again, back to what all the conversations have been by myself, Dr. Caldwell, Dr. Powers, and others. This virus, while proportionally maybe more younger people have it, disproportionately, this virus really devastates older people and people with medical comorbidities. So our recommendation is, as much as one can, and I know it's much easier said than done as somebody who's trying to shelter in place myself when I can, if you can minimize that outflow of traffic, of going places and interacting with people who maybe are outside of a small circle for you, that would be best. Now, I understand that may be challenging, but understand there is an increased risk to you as somebody who's older with medical problems.
And so is the recommendation that they only go out to obtain essential services? If so, what are those essential services? And for example, are seniors expected to forego haircuts for a year, for example?
What a great question. I think everyone has to take this all into consideration in their own, what makes sense for them. Now, if we're going by the book, right, and it's really easy to just say this and much harder to execute, is try to minimize. I have an 89 or 90-year-old grandmother who has medical problems, and so my mother, who's in her 60s, upper 60s now, tries to buy groceries for her, and I've recommended try to do grocery delivery services. I've recommended the haircut thing is a really interesting question. I hadn't thought about for a year. I mean, gosh, a few months makes it hard. If you choose to get a haircut, let's say because at a certain point that is going to be a necessity, use precautions. Tennessee people licensed haircut places have really good guidelines on what those are. But you should wear a mask. Your hairstylist should wear a mask. Make sure hands are washed pretty quickly. Try to minimize that exposure. Try to go to a place that doesn't have a big waiting area of people. But sure, if we're going purely by the books, the less exposure, the better. But I also recognize that certain life has to happen to an extent.
Next question, several people have touched on this. They're over 65 and they work. And they want to know, are we ever going to be released to return to work, or do we have to wait for a vaccine?
To be back to where we were before all this started, you need to wait for a vaccine. Now, if you do go out, if you can work from home, that'd be ideal. If you have to go to a place of work, speak with your employer. Obviously masks are important, washing your hands are important, but perhaps they can place you into a office that's separated from others. Maybe it can be walled off in some other way. Maybe you can have staggered hours, and so that you can come either earlier or later than the crowd, so you don't have to ride up and down elevators with a lot of people. So there may be ways you can modify what you do at work. But yes, ideally, stay at home.
Okay. Let's see. I think that's it. There were several questions about the phone numbers that were listed earlier. They will all be available on the website, and links. And this webinar will be available on the website with lots of other content. Dr. Caldwell?
Thank you all from me, and I'll defer to Dr. Caldwell.
Well, that gets us to the end of this particular webinar. As I said, this is just the beginning of a continued conversation of a series of different issues, this one focusing on those over age 65. I'd like to thank Mayor John Cooper as well as Mary Falls in the mayor's office. I'd also like to very much thank our information technology group and Charlotte Johnson, who helped put all of this together, and her team. Thanks to Dr. Alex Jahangir, who is the chair of our Board of Health, as well as the chair of the Mayor's Coronavirus Task Force, and to our participants, Grace Smith, Executive Director on the Council on Aging in Middle Tennessee, Dr. James Powers, the Division of Geriatric Medicine at Vanderbilt, and also Dr. Ari Nettles, Associate Professor of Clinical Pediatrics and Director of the Office of Inclusion and Health Equity at Vanderbilt. As well, she's the chair of the Statewide Planning and Policy Council on the Tennessee Department of Intellectual and Developmental Disabilities. Thanks to all of you for listening. I'm happy to let you know that this is being recorded, and you may have been trying to jot down the phone numbers or websites. That's all going to be included at the end of this video, and on our website. That website is covid19.nashville.gov, covid19.nashville.gov. We're all working our way slowly through this process. We are all trying to communicate and continue to live our lives in this new COVID world. We want to be safe, but we want it to be enjoyable. And all of you are there to help us make our connectivity with our elderly population one that is enriching and enjoyable and loving, but safe. So thank you very much. I look forward to seeing you soon.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.